By the end of this financial year, 18 million patients will have access to a GP at mornings, evenings and weekends. By the end of this Parliament, I want that for everyone. And this 7-day NHS will be just as vital in our hospitals too. It is a shocking fact, but mortality rates for patients admitted to hospital on a Sunday can be 16% higher than on a Wednesday, while the biggest numbers of seriously ill patients arrive at the weekend when hospitals are least well equipped to handle them. So 7-day care isn't just about a better service for the patient, it's also about saving lives. We simply can't aspire to be the safest healthcare system in the world without this commitment. While our hospitals are working hard Monday to Friday to get patients better, sometimes it can feel as though Saturdays and Sundays are more about just somehow getting through to Monday. Diseases don't work weekdays 9 to 5, and so neither can we. When you've sat through a night in a hospital watching a loved one and praying for the morning, when you've spent a weekend longing for the week, you know just how important these changes really are. So let's be absolutely clear. This is not about NHS staff working 7 days a week. It's about different shift patterns so that our doctors and nurses are able to give that incredible care whenever it's needed. It's about key decision makers being around at the weekend, junior doctors being properly supported, and crucially resources like scanners up and running whenever they're needed. Now, I don't underestimate the scale of the challenge in making all this happen. But just as we came together as a nation to create the National Health Service nearly 70 years ago, so I believe that together, by sticking to the plan, we can become the first country in the world to deliver a truly 7-day NHS. And we must do so to protect and preserve the values of the NHS that are so central to our national identity, to keep our people healthy, to look after them when they fall ill, to care for the elderly with dignity, and to ensure that free healthcare is always there whenever people need it most.